Hi everybody, this is your little introductory video to our next exam, which is the Chapter 6 exam, Blood, Lymphatic, and Immune Systems. And I am so excited for this one. This happens to be one of my favorite topics of all times. And that means that I just cannot possibly cut out anything. It's all so great. So anything and everything is fair game. I'll give you a couple pointers, a little bit of some hints that I think will help you figure out what this one's going to be all about. But please note that this is a two-part exam. There's the blood section of this chapter, and then there's the immune system, lymphatic system section. So study both. They are both important, and we'll probably have pretty equal representations. I think the blood chapter is a little bit longer, so make sure that you weight your studying accordingly. But they're not. There's no one that is, 75% of the exam or anything, okay? So just please note that there's more than one section to study. So if we take a look at the handout that you hopefully have printed out, it breaks down a couple different things. We broke down the two chapters here for you, or two sections of the chapter. Let me rephrase that. It's not two chapters. And the first part is looking at the blood. And we'll start by just talking a little bit about the components of the blood. And what you need to know about blood is that it's technically a connective tissue. And the reason for that is because it has a cellular component, which you can see here. And then it has a non-cellular or matrix component that they call it, which is the plasma. So that's what defines a connective tissue, and that's why blood falls into that category. So in the cellular component, we have a couple different types of cells. The red blood cells, also known as erythrocytes, the white blood cells, known as leukocytes, and then there are some cells known as thrombocytes, which are actually platelets. And to be truthful, they aren't cells at all. They are pieces of a much bigger cell that lives in the bone marrow that just kind of sheds off pieces of its cytoplasm. And so a platelet is not a true cell. It's not actually cellular, but it still gets the thrombocyte name. Don't know why. If we just backtrack a little bit, the red blood cells are pretty self-explanatory. There's one type. They lack nuclei and such. They actually lose all their organelles because as they mature, we want to make them flexible so they can fit in the capillaries, and we just spit out all of the organelles so that that red cell can move around and deliver oxygen and pick up waste as it was designed to do without any of those messy organelles in the way. Because of this, they only last for 120 days. They have to get recycled and we have to rebuild new ones, and we're always doing that all the time. So it's an interesting little thing about those red cells. The leukocytes, or white blood cells, can be broken down into two big categories, the granulocytes and the agranulocytes. And hopefully by this point in your medical terminology lives, you can figure out that a granulocyte is a cell with granules and an agranulocyte is a cell without granules. And I won't get into the specifics about those as much as I would love to, but please note that there are three types of granulocytes: the neutrophils, the eosinophils, and the basophils. Basically, anything that ends in the root word "phil" has granules in it. And then the two types of white blood cells that lack granules are the lymphocytes and monocytes. So you can use those endings to help remind you which category they fall in. All important in the immune system and keeping your body healthy, protecting you from disease. Then, as I said, the platelets are not actually cells. They are involved in clotting. They're really important in making a plug when a vessel ruptures so that you don't bleed, bleed, bleed. One of the things you actually don't have to know are the prothrombin, thromboplastin, and thrombin words. There's a really big complicated cascade that shows you how a clot is formed, and those words relate to that cascade. However, you don't have to know it, so don't worry about it. Okay? The non-cellular part of the blood is called plasma, and it's pretty much mostly water, but it has lots of really good stuff dissolved in it too. There's ions, salts, potassium and chlorine, and sodium and calcium. Can't forget that one. It has lots of proteins, antibodies, immunoglobulins, basically, or I think your book refers to them as gamma globulins. That's another word for immunoglobulin, but it's just an antibody. Hormones are in there. All sorts of things are circulating. Really important stuff. Got to have a place for all of your cells to be, and that happens to be the place, the plasma. You really should know, here's one of my hints, the anemias. I'm interested in that topic, and so you will see many of them showing up on this exam that's coming up. sickle cell anemia, iron deficiency anemia, hypochromic anemia, pernicious anemia. Know the differences between those anemias. They all are related to a red blood cell lack or a hemoglobin lack. And hemoglobin is a molecule in a red cell. But you need to know the specific types. I think there's actually a few more. There's hemolytic anemia. Make sure you know them all. That's a big hint. Okay. So moving on to the immune system here, we've got a couple different parts that we're going to talk about. Basically, the immune system and lymphatic systems are pretty closely tied. The immune system is sort of within the lymphatic system structure. So you have little vessels that pick up tissue fluid, and they originate in around your digestive tract, and they take that tissue fluid and they circulate it throughout your body, and then they dump the fluid back into your normal blood vessel circulation in the thoracic duct, the right thoracic duct. So it's kind of like this secret little vascular system that you didn't know about until you learned about the lymphatic system. And all your immune system cells, a lot of them hang out there, and they also hang out in the peripheral blood. So there is a relationship between the two. Lymph is the name for plasma that has left the blood, and it will collect in the tissues and then be picked up by the lymphatic vessels and travel back to your circulation, as I said. You do not have to know the different lymph node sites, and you also don't have to know the information regarding immunity on pages 196 and 197. That's why you should take general immunology with Dr. Werner, because that's good stuff to know, and it's a really interesting topic. So keep that in the back of your head as you go. So if we move down here a little bit to the bottom part of our page, you will see that there's some important immune disorders that I would like you to know. Some of these will probably be pretty self-explanatory, but we'll go over them anyway. An autoimmune disorder is when your immune system attacks itself. Auto, self, obviously. Anaphylactic shock, let's make that correction, or anaphylaxis is a response to allergens. So sometimes you might have a friend or yourself are allergic to bees, and when you get stung, you get this huge, crazy reaction called anaphylaxis, where your throat closes and your eyes swell and everything is going really badly, and you could actually die from it. That is a result of an overreaction of your immune system to something that's not really that scary, a bee sting or a peanut or shellfish or something along those lines. Patients who have this condition are recommended to have an EpiPen with them. It's basically a big injection of epinephrine, and when they come into contact with that dangerous allergen, they are to inject it right into their thigh. They push down right into the thigh and give themselves that epinephrine, and that keeps them alive until they can get to the hospital where they can be treated, because it can be very dangerous, very, very dangerous. Hodgkin's disease or Hodgkin's lymphoma is a cancer of the lymph cells in the lymph nodes, which are areas kind of throughout your body where you find these immune system cells, a lot of them in the armpits and the groin and the neck. But those lymph nodes can become cancerous, and if they do, it's known as Hodgkin's lymphoma, Hodgkin's disease. Non-Hodgkin's lymphoma is a cancer of other lymphatic tissue. So you might see like the thymus, or perhaps the spleen, or other places within the body that are considered lymphatic or immune system tissue that become cancerous. That's non-Hodgkin's, just not the lymph nodes. AIDS is also known as acquired immunodeficiency syndrome. It is really important that you know what all those things stand for, because I'll probably ask you that. It is caused by the HIV virus, and so you can see here under other vocab related to AIDS, HIV is something that you should know. That's the actual virus that causes AIDS. Just because you have HIV doesn't mean you're HIV positive, let me rephrase that, doesn't mean that you have AIDS. Basically, they monitor your white blood cell levels, and as they drop, when you get to a certain level, when you're so low, you get past X amount of a particular white blood cell, then they'll say, okay, you actually have AIDS. So they diagnose you with AIDS based on your white blood cell levels, essentially. Kaposi sarcoma is a type of cancer that was really common, or is common, in patients who have HIV because their immune systems get damaged and they cannot protect themselves from this type of cancer. When HIV first kind of came around, this was one of the things doctors were seeing a lot of, and they're going, well, why is there so much Kaposi sarcoma? This is really strange. And then they finally tied it back to the presence of this virus. So it was important in the history of understanding HIV. That was an important thing. Pneumocystis pneumonia, you can see that it is is a type of pneumonia caused by a particular pathogen, and it is generally found in patients who are immunocompromised, and that's basically the end result of having AIDS is you're immunocompromised, your immune system can't fight. So it's caused by the bacteria Pneumocystis pneumonia, and it can be pretty dangerous. They actually switched they realized that they had it classified wrong. It used to be known as being called by Pneumocystis carinii, but they realized they were identifying the wrong cell and realized it was a different strain called Urovetsi. So if you learned it a different way, this is same idea but updated version. And opportunistic infections are infections that most people with healthy immune systems wouldn't get sick from, but if you have someone who has a suppressed immune system because they have HIV or just because their immune system is down for whatever reason, you can get an opportunistic infection. So for example, yeast infections often happen when someone's immune system is compromised. They're unable to fight off the normally inhabiting yeast in their body, and then it takes over and you get a yeast infection. So that can happen in lots of circumstances, not just AIDS, but it does get related to it, because a lot of times opportunistic infections that wouldn't normally make a healthy person sick could kill someone who has a very advanced stage of AIDS. So it's important to monitor that. Okay? Keep an eye out for an email regarding where our next exam will be. Any questions, you know where to find me. Best of luck studying. See you in a week.